Hello everyone, I'm Dr. Nikolaou and I'm a dentist with special interest in dental implantology. Today we recorded a video about bone grafting in dental implantology. Another name for the same procedure is bone augmentation. So let's explain briefly what bone grafting is. Bone grafting is a surgical procedure performed to restore or enhance the bone structure in the jaw. It is commonly used in cases where the patient has experienced bone loss due to factors such as tooth loss, gum disease, or trauma. There are 4 different types of grafting materials that can be used in implant dentistry, and those are autografts, allografts, xenografts, and alloplastic materials, which are synthetic. So let's start with autografts. Autografts, first of all, involve using the patient's own bone as a grafting material. In this technique, bone is typically harvested from removing a small piece of bone from another area in the patient's body, such as chin, ramus, or even hip when a larger amount of grafting material is required. The bone is then carefully transplanted to the affected area in the jaw where bone loss has occurred. Autografts are often considered the gold standard for bone grafting because the patient's own bone has the best potential for successful integration and healing. Now, let's move on to allografts now. Allografts involve using grafting material obtained from a human donor, typically from a tissue bank. The donor bone is thoroughly processed and sterilized to eliminate the risk of disease transmission or rejection. That's why allografts can be a very good alternative to autografts when autografts are not feasible or they're not preferred by the patient. In the third category, we have the xenografts, and those are biological grafting materials used in dental procedures, dental implant procedures, where the bone tissue comes from another species, such as cows or pigs, also processed and sterilized, and they are augmented to humans to replace missing or defective jawbone during implant procedures. Alloplastic materials, finally, on the other hand, are synthetic substances used in various different medical applications, including reconstruction surgery or implant dentistry. These materials are designed to mimic the properties and functions of natural tissues. The choice between those 4 different grafting materials depends on several different factors, such as the specific clinical needs, the patient's condition, and of course the surgeon's expertise and preference. Thank you very much for watching, and see you again next time.